Today, we are honored to welcome Kevin Brown to the show today. He is a physical therapist and strength and conditioning coach. This is very exciting information, and I'm very happy to have him on the show today because fitness is one of the most important pillars of wellness. And of course, it's cool to have things to do, go to the gym, but if we actually have a plan and know what we're doing, this makes it that much more effective. So, how are you doing today, Kevin?
Doing well. Thanks for asking. How are you?
Absolutely, man. I'm doing good. I'm very interested to hear your story and how you got into physical therapy and fitness in the first place.
Yeah, absolutely. I was a gymnast all through, high school. I actually competed for Ohio State. So did gymnastics in college, and kind of my whole life was revolved around movement, athletics, sports. I knew a physical therapist growing up, and kind of just wanted to help at first athletes, recover from injury and just kind of stay in athletics. But as I got into, grad school and then started treating, I really specialized in orthopedics and sports medicine. And I loved the movement health aspect of what physical therapists do. So, helping someone go from, being in pain to being able to perform at a high level and really just be able to move well. And I realized that movement and strength, that's really what we were doing in physical therapy. The two are so interconnected. And I found early on in my career that just traditional physical therapy, there was a huge gap in what we were providing patients. Working with them even post-operatively for 3 to 4 months, addressing their soft tissue injury and baseline level of function. We weren't really helping them achieve a level of movement, health, and strength that will allow them to really do the things they want to do and create a large buffer zone so that they could be healthy, active, and pain-free long-term. A lot of patients would go through physical therapy, they'd feel better, but the time frame was so short, and what we were working on them with was really concentrated on their specific injury, so they would most likely, after physical therapy, just revert back to the same kind of patterns they had before, because most people aren't consistent exercise. They don't have a good level of movement, strength, mobility, balance as a whole. Prior to physical therapy, they have the opposite. They've been really inactive for sometimes 15, 20, 30 years, and then they have this pain that brings them in, and then they start moving, and that helps with their pain. But we really just scratch the surface in those first 4 to 6 weeks of physical therapy, even seeing them 2 or 3 times a week. That's where I really developed a different mindset and a different even business model where we can help people through traditional physical therapy, but then we continue working with them until they've reached an objective standard that's going to allow them to live life without any physical limitations and understand how to really utilize exercise long term to be healthy, active, and pain free.
Awesome. Thank you for sharing your story, man. So it sounds like you were kind of disappointed with the traditional model. You weren't seeing the results that you wanted. So you kind of went out and learned a lot more and created essentially a new system of helping people. Is that right?
Yeah, I mean it's just the exercise it's been around forever, but we packaged it in a way that really was able to teach people how to objectively improve their level of movement, strength, flexibility, and balance, and relate that to their pain and help them. That's the science of pain management, the science of movement, but it's all wrapped up into a combination of physical therapy and fitness.
Awesome, man. So can you define fitness? I mean, that obviously is something people know about, but I feel like there's so many different aspects of it. It can kind of be a vague topic, but can you define that and how fitness actually plays a role in people's life?
Yeah, I think there's many types of fitness. You have cardiovascular fitness, which is how well your heart is functioning, and you have muscular fitness, and you just have in my opinion, you have movement, which covers balance, strength, mobility, your ability to do the things you want to do, and then fitness is the endurance aspect of it. That's a simplified version, but if you can do everything that you want to do in life, or you can do everything that's required to play your sport, you can run, you can jump, you can throw a baseball. It's like, how well can you do that, and for how long is your fitness aspect? So, for us as normal human beings, let's say we can go up the steps and we can walk and we can do everything in life. I always kind of use my hands to explain it. If this is life and this is your fitness level, then life's going to feel really hard. you can do everything, but it feels like you're running a marathon every day. As you improve your fitness, what happens is life becomes easy and you create this buffer zone. So that's what, when I explain it to people, it's more of the endurance aspect of your movement skills and your ability to move, and your baseline level of strength. Strength and fitness go hand in hand. So that's how I look at it. That's how I explain it. So for an athlete, like, their fitness level has to be much higher, and even their movement ability has to be much higher, just to be able to do the sport, and then to be able to do it at a high level or at the highest level, they really need, increased levels of fitness. But for everyday adults, we need a certain level of fitness too, just to not just get through life, but to be able to enjoy it, and not feel like there's things in life that, hey, I want to go on that hike, but I don't know if I'll make it. I don't know how I'll feel when I do it. If you're not fit enough, then you may not be able to do that hike or enjoy it.
Very well. So it sounds like fitness allows us to be productive in life, essentially. We can actually live a life that we want to, because a lot of us, as you know, we're just in pain and we're not able to do the activities that we actually love. So getting our fitness up to par can help us live a life that we actually want to.
Yeah, yeah. I mean, and it relates, like, pain and fitness are all tied together. But if you only look at fitness and you don't look at movement, movement is that baseline level, that bottom pillar that has to be the strongest, because you can't really build fitness on top of poor movement. Really good athletes and people that are really fit, when they have injuries, it's usually a breakdown in their movement, or they're just overloading too much, like they're just overdoing it too much, or they have a acute injury. Someone runs in their leg and tears a ligament. Obviously, that's going to create an injury. But most injuries we see are due to overuse or a lack of movement or muscular imbalances. But then they're trying to do something that requires a certain level of fitness. Their soft tissues in their body just can't handle it, so their body breaks down. And then that cycle repeats itself on a daily, weekly, monthly, yearly basis, and eventually you get these compensations and you have this injury. But it's all wrapped up into their movement and their fitness level.
Absolutely. So it sounds like there's a difference between fitness and movement, like a formal session in the gym, but then movement throughout the day. Do I have that right?
Yeah, and movement throughout the day. So that's like daily. And then when I look at daily movement, that's the cardiovascular aspect of someone's routine. But when I talk about movement, I mean quality, like, how their hips move, how their shoulder functions. Can they bend down and pick something up? Can they actually get on and off the ground? Do they have the flexibility? Like, every movement requires a certain level of what we would call mobility and stability. So, like, just to reach up and grab a cup of coffee, you have to have enough range of motion in your shoulder and, like, flexibility in the muscles that allow the shoulder to move. But you also have enough stability in, like, the shoulder girdle and the scapula to be able to do that action without compensatory movements. And so without, like, hiking up your shoulder. Someone after surgery, they can kind of get that arm up there, but it's done in a really funky way. They compensate. So their movement isn't where it needs to be. And then you can break down movement into mobility, stability, and what we call motor control. So, like, you can have people who are really flexible and they may be really strong, but they're just uncoordinated, or they don't have what we call the motor control. Coordination, motor control can be thought of as similar. So we're always addressing something in that regard when you're working on movement. But then once you dial in the movement, then you can really build strength and fitness on top of it. That's how
That makes a lot of sense, man. So in terms of the movement aspects, you just talked about three pillars pretty much. So mobility, of course, and range of motion, all that. You want to go a little bit deeper into that, because I feel that's so important. As you said, it's kind of the foundation of which you build strength on.
Yeah, I mean, so when you look at, like, some people, like, these terms can get misconstrued. They're fad terms. So, like, mobility, flexibility, so it's just how you look at it. But when I think of mobility, I think of it as your ability to move or complete a certain movement. And the mobility aspect of that movement is the range of motion, and, like, it's either going to come through the joint or the muscle, like restrictions. If you can't bend down and touch your toes, if it's a mobility restriction, it's either going to come from, like, your hamstrings, your hips, or maybe your low back is a little tight. And that's what, from a mobility standpoint, that's what's going to not allow you to do that movement. But in bending over in your toes, you don't just need enough mobility in your hips, you need enough stability in your hamstrings and enough motor control to learn how to sit your hips back. So it's usually it's never just one thing or the other. And obviously we have a way to figure out where, from an assessment, you can figure out why. You have to break down the movement into its parts and see why they can't do it. It's usually a combination of all three: a little lacking mobility, lacking stability, and motor control. And once you start addressing all three of those, but then you got to put it together as a whole movement. That's where the movement starts to improve, the pain goes away, and then now they can do the movement. It's much more, fluid and free, and it's not painful. Then you can start to load that movement or add resistance to that movement to create strength building, the strength building process.
Awesome.
That's the process of helping someone who doesn't move really well and has pain, helping them move better, reducing that pain, and then adding fitness so there's a buffer zone, and they're able to not just relieve pain for a short period of time, but relieve it long term.
That makes a lot of sense, man. Because I see a lot of people who just have these dysfunctional movement patterns, and it's really leading to so much pain throughout their lives. And maybe okay in the beginning, but then do you believe that's kind of what leads to this chronic pain and all these joint issues along the way?
I think most musculoskeletal issues, even most everyone's pain, the physical, what we call mechanical pain, not caused by a kidney stone can cause low back pain, but that's not the type of pain we're talking about. Mechanical pain that has to do with the musculoskeletal system, yes, there's always at least a small component, but usually a large component of that pain is due to somewhere in their movement or their strength. Even people with bone-on-bone arthritis in their knees, you can have people who have that degree of arthritis, or if they look at an x-ray or an MRI, they can see a lot of structural dysfunction. That's not always the cause of their pain. That may be a small percentage of that pain. Most people over the age of 40 have something wrong on an MRI with their rotator cuff, some sort of tearing, but most people don't have pain in their shoulder. Why is that? Because the rotator cuff tear doesn't always cause the pain. The image doesn't always tell the story. That rotator cuff or that arthritis could have been present for a very long period of time prior to pain. What happens, and we have the research to show it, over time your movement starts to erode, and then you start to have pain, and they go and do the image, and they find something, but they never really tested your mobility, your strength, your motor control, and how the muscles are working, because in order to test that, there's no scan that you can do. You have to put someone through a movement assessment, and then you have to address it, and it takes a couple weeks to address it. But once you address it, even if you get 50% improvement in pain, you didn't change the structure. I didn't all of a sudden make your knee less arthritic, or I didn't heal your rotator cuff tear, but why is your shoulder feeling better? It's because a large percentage of your pain was due to the fact that you had muscular imbalances. Now sometimes some people have such bad arthritis or such, the tendons torn to a degree that they need surgical intervention, or they need an injection to manage some of the inflammation and pain. And I think the two go hand in hand. I love working with physicians who look at the movement side and the medical management, whether it's like a prednisone pack or a steroid or an injection or something to help with inflammation and pain. But if you don't address the potentially the root cause, which is in their movement and their strength, you're always going to be chasing symptoms, and they're not going to help, and it's going to lead them towards possibly an unnecessary surgery.
Absolutely.
That's kind of the system that we live in, and surgery is not all bad. Some patients really need surgery, and you don't want to waste them away in physical therapy if they're not getting better, but you also don't want to not give it a chance. And sometimes they need more than physical therapy. They need time to, gain strength and gain mobility in their soft tissue. It just takes more time than people are willing to give it sometimes. And you have to be objective about how much improvement they're making, and then make the decision that's best for the patient.
Definitely. I like that, man. The image does not always tell the story. I think that's a great quote there.
It's been said way before me, so I can't take credit for it. But
Yeah,
it's
because
the truth. That's why even insurance companies don't always get it right, but they do. They usually make people go through some sort of physical therapy before they order the MRI, because they know they don't want someone just jumping into, going to fix the structure if you haven't looked at the function yet.
absolutely. So, how do we begin to develop proprioception? Like our ability to kind of move throughout space coordination, all that, because that's such an important part as well, just being able to move efficiently.
Yeah, I mean, it all starts as a baby. You learn. That's if you watch if you have kids, or if you had, my kids are 8 and almost 6, so I remember watching them learn how to walk. Like they're as like babies and even toddlers, they have a lot of laxity in their joints, and their the type 1, type 2 muscle fibers are it's reversed. Before they hit puberty, they have a lot more mobility, and so they have to learn how to control it. They're low to the ground, so if they fall, it's not going to bother them. But they practice all day long, and they just learn it by doing it. They start by rolling over from their back to their stomach, and they get up on that quadruped position, and they start pulling the stand. And then it's not pretty, but they just do it all the time, all day long, pretty much. And then they learn, and you develop that awareness of your body over time. And if you keep moving and you keep challenging the muscular system, and nothing horribly goes wrong with your nervous system, you don't have like a spinal cord injury or something crazy, you're most likely going to maintain that good proprioception and awareness. But when we stop moving and we decline our strength, we start to lose our proprioception because we don't use it. There's stats that say, like, after the age of 30, how many people actually sprint ever. So if you're the amount of activity that you start to do shrinks, you start to lose things. And one of the things you can lose is proprioception, because if you don't use your body fully, like, you start to limit how you use your body. There's going to be certain aspects of what you used to be able to do, or what you should be able to do, that you can't anymore because you haven't practiced it. And so just the day-to-day life, sitting at a computer, driving a car, it's very repetitive. It's mostly just sitting and watching TV, and your body, you can go years without ever even looking fully up at the ceiling, using your neck in its full range. So it gets tight, and the muscles start to shrink, and you start to lose proprioception because you never experienced that range of motion, or it's been months or years since you've ever experienced not only that range of motion, but maybe at that speed. You're doing everything a little slower, a little with less mobility. That's how it happens. It just, over time, it's very slow, and people don't notice it until it starts to affect something that they actually want to do, or they go to do something that they used to be able to do at the speed they used to do it at, and they tweak a hamstring or something, and they're like, oh, and that's what happens. It's not a mystery. It's just, so if you can maintain that level, we have to, understand that there's a certain standard of movement, strength, mobility, balance, function, what we call movement health, that everyone needs just to be able to do the basics, right? And if you lose that, that's where you start to really see the decline in function and the increase in pain. And so you lose your fitness, but that level of movement and fitness is usually lost, it takes a long time to lose that. And that's the bare stand. Like when I go into my annual physical, I feel like that's something they should be checking, right? Am I at least there, right? Can I get on and off the ground? Can I go up steps without using a handrail? So you don't get to the point where you physically can't do that stuff. It needs to be like a red flag needs to pop up. But most time patients, they don't ask them to get on and off the ground. They just assume that you're 60 and you probably can't do it. But there's no reason why. Like if that was caught the first time, then we wouldn't have a lot of the problem, a lot of the falls, a lot of the stuff. So
Absolutely.
That's my soapbox. But yeah, I think I even forget the question, but yeah, that's like proprioception is built from a kid onward, and then if you continue to move and you continue to move often and you challenge your movement system, you'll maintain your proprioception. But if you start to decline, deviate and not use certain aspects of movement, whether it's shoulder range of motion, neck mobility, running, jumping, like those things, you'll lose it. You'll start to lose it, and it's really hard to get it back sometimes.
Absolutely. These basic movement patterns that we just lose as we go on, it's kind of sad. And a lot of it is responsible for the, hesitation in life as well. We kind of go downhill and get chronic diseases, and a lot of it comes down to just, staying functional. And like you said, a lot of us lose that, and it's unfortunate.
Mm-hmm. Yeah. So that's what our whole business is built on. That's what we have a standard of movement, strength, mobility that we say and we can grade it out based on exercise and your ability to perform certain exercises. And then there's obviously the subject, what you're telling us, do you have pain throughout the day? Because that's not normal, as we get older. Most of our clients are in their 40s, 50s, 60s, and 70s, and some of them think like, yeah, I'm 50, it's just normal that my back hurts all day because I'm getting older, but that's not normal, that's not healthy. So if we can address it while they have a decent amount of movement, it's easier to address it if their movement quality is not declined. When people have a lot of pain and their movement quality and their ability to move is really, really low, like they're walking on a walker, they're really hunched over, it's really hard to address their pain because biomechanically they've changed so much that it's hard. So if you're 45 and 50 and you're starting to feel like you've lost like a step, now's the time to fix it because it's going to be a lot easier to do it now. You have to build the habits. If you had the right habits and you had the knowledge, you would have fixed it already. So you have to find somewhere where they're going to, instill the habits around exercise, possibly nutrition, maybe a missing element, but then, helping you move better, learn how to move better, and so you can get back to where you should be as a healthy, I don't care if you're 50, 60, or 70, it's the same standard in terms of movement. And then obviously you want to be as fit as possible.
100%. Yeah, it's always about those basic movement patterns that you said and really developing those habits. And the time is now. So like these things don't develop. And education is probably one of the first steps, right? Actually becoming aware of these things, because the modern world that we live in, it makes it so much easier to be, dysfunctional. So we have to be proactive in the modern world, but we probably wouldn't have to like in the distant past.
Well, even like, not that I know much about it, but there's research to show that in a third world country, they have a lot less incidence of low back pain because they have to squat to sit, like they don't sit in chairs, so they squat to use the bathroom and they squat. This is very well documented, but not saying that we should get rid of our chairs, but it's just that they have much less back pain. We've done all these things. Like we know low back pain. Like I think the stat is 80% of people at some point in their life is going to have an episode of low back pain, and we've done a lot. We've tried a lot to fix it, but it just gets worse. Like obesity and back pain are probably getting worse and worse as the decades go on. We're not really making a dent in the improvement. We're not slowing it down because there's no pill to do that. There's no injection that's going to fix that. We have to change our habits, and we have to change the way we evaluate health, from a movement perspective. Like we do a good job at evaluating, being proactive about blood pressure and heart rate and screening for certain diseases, but we don't screen for movement health until it's too late, until it's a problem. And then we're really reactive. We send them to physical therapy, we give them injections, we do all that stuff. But we should be screening for this on at least an annual basis with a doctor. Just the primary care system isn't built. And you're not to do it properly. You have to. It takes at least a half hour to take someone through it. And then it's one thing to screen for it, but then what if you find something? You don't want to just screen for it. You want to be able to address it, and to address it takes even longer. And they have to have the systems to do that. So physical therapy does a decent job at addressing it, but only reactively, not really proactively. So at least in the traditional model. So that's where we try to when we communicate with the public, we communicate with physicians. We want everyone walking around to at least look at their movement health and understand what's healthy and what's not healthy, and then understand, okay, these are the types of exercises that I should be able to do. This is the quality that I should be able to do them with, and this is the amount of strength within each movement that I want to be able to maintain. And I should be doing this 2 to 3 days a week, right? If you don't have those habits built in, then you need to get some accountability and develop those habits. But usually it's a combination of the habits and the skill. Like they don't know what to do. They couldn't do it correctly if they wanted to because they just don't have the movement skills yet, or they've lost the skills. But then they also don't have the habits. So it's all three of them, and that's really that's what we help with.
Definitely building those skills so we can actually do the bigger moves and focus on strength and all that, which we'll get into soon. So I appreciate you sharing that, man.
No problem.
Yeah, I haven't talked a whole lot about muscle fibers on the show. Would you like to talk about that briefly and like different types and their functions?
Yeah, and I probably I don't know much. That's not my expertise, but I'll say like with muscle, and I get them mixed up. It's been so type 1, type 2 muscle fibers. I want to say I'm going to mix it up, but one of them is slow twitch, fast twitch muscle fibers. Um, Obviously, it's not for the general public. That's not going to make a huge difference in like knowing those and training those systems. Like if you're looking for that extra 0.001% to go from I want to win the gold medal and the 100-meter sprint, then yeah, it's going to make a difference. Like every little bit matters. But when you're exercising, like that's why we keep it. Like we have a lot of people, even like youth athletes, they're good at their sport and they come to us thinking they want to get faster, like they want to do speed training. But then when we break it down, their movement is missing. It's like, I'm not going to take someone who runs a 4.840 and make them run a 4.2. Like genetically, they're just. I mean, I know the parents don't want to hear it, but they're not going to do it. Like genetically, you're not going to be that much. Like your genetics are going to play a role in how fast, what's the top end speed you can get, but your ability to perform at a high level without getting hurt, that's something that we can affect. We can and give you the strength and stability and balance and recovery tools. So number one, you can stay on the field, and number two, you can maximize your genetic capability. That's really what when we work with athletes, that's what we're working on. So like with the muscle fibers, that's why I don't get into that. I'm not the expert on that. But we look at things more generally, and we feel like that covers 99.99% of people. But there are those people that they really doing that extra little bit is going to make the difference in their sport. But for the general public, for life, for most health and fitness goals, it's not it's not needed. I was a gymnast, so like to do an iron cross and to do those things were required for my sport, but they're definitely not required for me anymore as a 38-year-old dad. And if I try to do those, I may risk tearing my labrum or doing something crazy. I can still do some stuff, but it's just not. It's not worth. It's risk reward to me. It's not worth it.
That makes sense, man. So it sounds like for the tippy top athletes, maybe focus on those things and start to fine tune certain movement patterns in terms of muscle fibers. But generally, there are certain principles of movement and fitness that kind of apply to everyone. Do I have that right?
Yeah, that'd be fair. That's good. Good characterization.
Awesome. So how do we start to develop strength? Because this is such an important pillar, if not the most important pillar of fitness. Like having that muscle on your frame to kind of move throughout your life and have that longevity. Like how do we start that process, man?
Yeah, I mean, I think just like anything, just like pain relief, it starts with movement, and then once you can move and you're really trying to build strength, you just have to put the muscle under tension and under load or resistance, enough to create change. So there's a lot of ways to do that. Like if you're going to do, higher, like I believe in doing for most general public and most fitness goals, if you can do a movement under load for 15 to 20 reps, and it's challenging for you. You don't have to go to failure. It doesn't have to, and you can maintain the quality of the movement throughout 15 to 20 reps, but it's challenging for you. Once you can get to 20, it becomes not so challenging. Then you can increase the amount of load, the amount of weight, and then you usually at first you would decrease the amount of reps and then build back up to being able to do 20 reps. But you can do it in a lot of different ways. There's not one right way. That's just an easy way for me to help quantify. Okay, are we building strength with this individual? Because we've been doing a squat or we're doing a push-up, right? So if they're doing like a push-up on a elevated surface, right, maybe a 20-inch box, and so once they can do 2-3 sets of 20 push-ups at that level, like it's time to go make it harder. So maybe they go to the floor, but when they go to the floor, now they can only do 10 push-ups. But now they went from, then after a couple months, now they can do 2 sets of 20 on the floor. So they went from being able to do 3 sets of 20 on an elevated box to 3 sets of 20 on the floor. They've objectively gotten stronger, right?
Definitely.
So that's an easier way to do it in my mind. And then obviously for some people, like we're not always, and my wife always asks me this, like I need to get stronger, but like with certain movements, you're not going to do any more load. Like you're not gonna keep benching. Like once I get to 150 pounds or 200 pounds or whatever, I'm not just gonna keep going up. There's some movements and some things that you're just gonna maintain, and like you're still getting stronger because you're consistently fatiguing the muscle. Like that's all we're trying to do. We're trying to add stress to the body so that the muscle can continue to grow, or at least maintain the growth that we've had. So it's not declining because we're all, as we age, we're all losing muscle mass as we age. Like, there's nothing you can do about it, but as sort of like peak muscle mass, it's just, genetically we're all losing. Men, I think, start at something like 28 or 30. Women start losing it at like 25. It just is what it is. But if you can maintain it, a lot of people have more muscle mass in their, let's say 50s than they did in their 30s because they never worked out before. They went from age 18 to age 30 and they were basically not moving at all, and then they're like, okay, I'm going to start moving and exercising, and they're in better shape, they're stronger, they have more muscle in their 50s because they built the habits from 30 to 50 and they built it up. So but that's really it. There's a lot of ways to load the muscle and create resistance and to build strength, but it's important to be objective, and you can't be objective if you're not picking a benchmark, like, whether it's I can do this many push-ups or this many squats or something that has to do with load, numbers, like time and retention. There has to be some objective metric that you're looking at, and that's the only variable you're really changing. And if you can increase that one variable, you're getting stronger. Obviously, there's intra, hypertrophy of a muscle. You can get really fancy and look at, lean muscle mass, and you can look at all the intramuscular cellular things of a muscle, but that would take extra testing to do that the average person's doesn't need to do, and they don't have access to.
Absolutely, man. So it sounds like you're a fan of progressive overload. Do I have that right?
Yeah, to a point, as long as you have good quality movement and you are keeping the risk reward, always thinking in those terms, like, all right, I could load this muscle a little more, but what's the risk to my low back or risk to my shoulders or just my soft tissue quality in general? Like, am I sore that day? How am I feeling? How does my body feel? Am I recovering appropriately? All those things, because you can do too much, right? And most people don't exercise nearly enough, but there are some people that exercise too much, or if they haven't exercised in a long time and they're starting, they go way too fast, way too quickly, and then it leads to negative results.
Absolutely. And what is the importance of having high quality muscle? Like, what can people start to notice in their life and kind of achieve the benefits to whatever it is that they're doing? Because, as you know, like, it applies to everything. If you have consistent fitness routine, you're going to notice you're going to be stronger in other areas as well, and just be also a better decision maker. That's what I find.
Yeah, having strength, it allows you to do the things you want to do, whether it's push open a door or open up a jar of pickles, or walk, run, get up the hill, pick up your kids, move the furniture, whatever. You need that just as a human being to function, to get in and out of bed, to get up and down from the chair. So it's going to allow you to do those things. And if you have more muscle, and you're stronger, you have a bigger buffer zone. Because, like I said, we're all like losing it as we age. So if you take that perspective, like, if you're here and you start to go down, that's one thing. But if you start here and you start to go down even further, like, now you really lost it. So if you can create a buffer zone, your decline you won't even notice it, versus someone else who started way lower than you is declining. Now we're just getting closer to that point, that line that says I'm not strong enough to do the things I want to do. So the stronger you are, in your 20s and 30s and 40s, you can maintain that level. You have a large room to go before you would even notice it in your day-to-day life. That's the way I look at it. So, like, I'm not as strong as I was when I was 20 and I was a gymnast, but I have, if I can just maintain this level of strength that I have now, I'll be able to do pretty much anything I want for the rest of my life, and I won't ever, go down. And that's what I look at. I want to be the, my kids are 8 and 6, so I want to be able to, when their kids are 8 and 6, hopefully still be around and be able to do exactly what I'm doing now with them that I could do with the grandkids. Um, and I get on and off the ground, play, and have the cardiovascular energy and all that stuff just to be able to do the same things um, that I do now. And there's no
Yeah,
reason.
man, that's awesome. So it sounds like it's important to have this buffer zone so we can actually be more resilient to everything in life. Because if we have muscle in our frame, we're going to be much more recoverable when it comes to illness. Like we get sickness or whatever it is, we have much more tolerance of the external factors, like environmental factors that may cause disease. It just makes you much more resilient overall in life.
Yeah, and that's a good point. So I didn't even think about that. When you have, God forbid, you'd have to have a surgery someday. Whether it's, musculoskeletal surgery or like an orthopedic surgery or something else, and you have to be bedridden, right? If you have a good base prior to that, you're going to be able to recover faster, and you're not going to fall. You're not going to decline as much. Like you're going to be able to get back. It's a lot easier. Like the people that have knee replacements that spend 2-3 months prior building their strength prior to surgery do much better. And if you extrapolate that out, if you have some weird illness that kind of puts you out for a little bit, and you're already lacking strength, when you go through that, you may be crippled. You may have to be on a walk. You may not be. If you lose any more, and it's really hard. The further you are down on that spectrum of like strength, mobility, balance, function, the harder it is to get back to what we would call healthy. So if you can create that buffer zone and maintain it to a degree, you're going to be much more resilient to the unknown in life, which would be like I got in a car accident or I got some weird illness that kind of put me bedridden or whatever it is. And you're less
I
likely,
like that, man.
your immune system's better as well, but that's not really that's not my expertise either. So.
Yeah, muscle is your armor in life. I like it. Are there any other strength principles that you recommend people focus on, especially if they're just getting started?
No, like I said, I mean, so if you're looking at like, I want to strengthen a muscle, you have to be able to activate it first. So like, if you can't turn it on, like if you can't engage that muscle or feel it working under what we call like a low threshold movement. So like, I don't know, and I'm not showing you, but it's like a bridge. Like when you lay on your back and your knees are bent up and you just kind of squeeze your butt and lift your hips off the floor or off the table. When you do that movement, you should be able to feel the butt muscles working and extending in the hips. Okay, if you can't do that, that's a very low threshold. It's not like strength. It's not building strength, but it's using that muscle to form a hip extension movement. Now, if you can't feel that, or you feel it in your back because your back's compensating, when you do deadlifts, there's no chance that you're going to engage the right muscle and really strengthen your glutes or your hamstrings. You're going to be wrecking your back when you do it. So you have to learn how to engage the right muscle under what we call low threshold movements first. Once you have a good understanding of how to do that, then you can apply that to a more complex movement that you can really load. And those are more like compound movements like squats and lunges and hinge type movements. That's the only thing I would say is, it always starts with movement. You can't neglect the foundational piece. And that's where most people, even people that have been exercising for years and years, if they end up coming to us, it's usually because they lack that foundational piece, that movement piece. There's something that they've bypassed and they've just haven't addressed it, and it always comes back to bite them.
Yeah, I mean, some of us have muscles that we haven't activated in a very long time, and we wonder why we have all this dysfunction, right? Just being able to utilize our muscles in a way that they're designed to, in a sense.
Yeah, so yeah, if you can activate a muscle, create a good baseline level of foundational movement patterns, and then build strength on top of it, and then build your endurance, which is your fitness, on top of that, and and you constantly manage that system, and when you start to not feel good, or you've got to be in tune with what your body is telling you. So if you're starting to feel less, you know, less mobile, or like you're sore all the time, then you need to decrease the volume that you're doing, or look at what you're doing outside of exercise. Because at the end of the day, exercise is a tool to both maintain your movement, your strength, your balance, but it's also, I look at it as like an assessment tool. So if your everyday life, if you're walking, you're going up steps, you're bending down to pick something up, like that's great. Um, if you end up having pain with one of those movements, that means something is drastically wrong. But if you exercise consistently and you are always able to squat and hinge and lift a certain amount of weight, right? And then one day you can't do that. Well, that means that you've declined and you need to get back to your other level. But you won't notice that. That won't affect your day-to-day life. So people that exercise all the time, they have issues just with exercise, and they're able to address it before it affects their day-to-day life. But if you never exercise and you never put your body through that, you're only going to start to notice pain and dysfunction when it starts to affect the basics, which is like getting up and down from the chair, going up in steps. And by the time your movement and your strength have declined so much that it's affecting that, I mean, it's been going on for years, and that's why those people they develop chronic pain. So if you don't exercise, if you're not exercising consistently, you don't know that until it's almost not too late. Like obviously, those people can be helped, and we do that. That's 99% of the people that we help are those people, but that's why it takes longer to address it, because they haven't been exercising for the last 20 years. So by the time they have pain, it's not just a quick fix. Because it's not just, I start hurting. They always say, like, it just came out of nowhere. I just started hurting yesterday. But it really probably was building for 15 years in some regard. So until you kind of compensated, you stopped this, and you just started settling for less and less movements. And then over time, it's the straw that broke the camel's back. Maybe I bent over wrong. I felt it. But really it was brewing for a while.
Absolutely, man. That makes a lot of sense. All right, Kevin, this has been awesome. I really appreciate you coming on the show today and sharing your story, sharing your insights with us. It's been a blessing. I mean, it's so important to talk about fitness and everything about mobility and all that, because these are tools that we can utilize for a lifetime, right? Having the gift of fitness in our lives that leads us to live the best version of ourselves, because if we're stiff, if we're immobile, it affects our energy levels in a way that we don't really understand until we get that going on. So again, I thank you, man. And if people want to connect with you and your work, where can we go for that?
Yeah, I think the easiest way, obviously, we're in suburb of Columbus, Ohio, so Gahanna, and then our website, Performance Therapy 1, just the number 1.com, and then our number is 614-981-9517. I'll just say it again, 614-981-9517. Text it, call it, or go to the website, performancetherapy1.com, and we have a couple forms you can use to contact us that way as well. But yeah, we're always happy to help, and I would love to hear from you guys.
All right. I appreciate it.
Thanks.